I'm Dr. Stephen Combs. I'm a retired orthopedic surgeon. I was an orthopedic surgeon at Lake Health from June 1979 until the end of December in 2016. So 38 years of practicing orthopedic surgery.
My relationship with Dr. Combs, being a partner, being in his practice, coming into the setting of a situation where he's grown this practice over 30 plus years, I would consider him to be a mentor and trying to learn from his experience, observing and learning techniques that he had evolved over the years and then incorporating that into what I had been trained to do and what was learning to do on my own.
When you're practicing, like we do, and you go from room to room to room to see your patients, sitting down, standing up, that sort of stuff. And so when it got to the point where it was kind of hard to keep that pace up, that's sort of when I knew that it was time to get something done. I knew I had arthritis in my knee, but I also had a torn cartilage that would lock my knee up. So Dr. Webb and I talked about it and decided just to go ahead and do a total knee replacement.
You get to the stage of getting or needing a knee replacement after many years of having arthritis, where the cartilage layers of the knee joint begin to erode away or be absorbed by the body. When that happens, it becomes more painful and uncomfortable to do day-to-day activities that used to be very easy for people to do. Usually when considering the knee replacement, you should think about things that used to be enjoyable for you but may not be anymore, or you may just completely avoid doing these things altogether. And that's usually the time that I recommend to the patient to think more strongly about proceeding with a surgery.
I really felt fairly comfortable having this done. I had both my knees done by Dr. Webb. I know the type of surgeon he is, I know the results he gets. I wanted the best total knee I could get, and I knew he would give me that. I had good faith in the anesthesiologist that we have, and the nursing staff, and the surgical staff, and the nurses on the floor.
I think he's probably the closest person that I've had a personal relationship with that I've operated on.
Having been doing this for 20 plus years, 30 plus years, it does give me a different perspective when you start in therapy. Just say, okay, this is going to be tight, it's going to be sore, but I can work through it. And if you do that, you will end up with fairly decent motion in your knee. I don't even think about having had my knees replaced. I'm pleased with it. I can get around. I can do pretty much everything I want to do. Go up and down stairs. I can walk my dog. Actually, my dog walks me. I can swim, work in the garden. I like to garden.
A successful knee replacement is somebody who comes in 2 months or a year later and says, "Doctor, you changed my life." That brings me a lot of satisfaction, and that's why I keep coming back to doing this.